my wife's a dietitian, and we talk about health and wellness all the time, and it's our food system's horrible. And that doesn't help. It's like all the stuff that they promote, like the old pyramid system where grains are the number one thing you should be eating and all these like diets. And it's crazy that food system, I think, is making you even more sick.
Yeah.
But then you also have all these people that, you know, try this diet, try that diet, try keto, try this. It's like, what are you supposed to do?
I thank you for that, because, okay, I want to unpack that a little bit because there's some good things there. Okay, first of all, if we focus on one big thing that changed in the late 90s that has decimated the health of humanity, and this one thing has made it very difficult for people to eat healthy. It's a chemical called glyphosate.
Oh, God. We've been talking about this for a while.
So what did it do? This chemical is sprayed on the majority of our food. As a matter of fact, it's estimated it's in 60 to 70% of rainfall. Okay, if you look at the thyroid belt that goes down the Mississippi, where all these thyroid cases are, they find levels of this chemical because of the farming through the roof. Okay, so what does it do? It opens up our protective barriers. It opens up our gut barrier. So what is common right now? If we took an interview, these people look very healthy, would you agree? I already had conversations with most of them. Most of them are battling certain food intolerances. I'm allergic to gluten, histamines. Like, I had all these conversations with this healthy group of people. Thyroid conditions. Well, glyphosate is linked to all of it because it opens up the gut. It allows undigested proteins to cross the gut into the bloodstream, and now our body makes antibodies. And now that can drive autoimmune, that drives food intolerances, food allergies, drives thyroid conditions. One chemical. Oh, and also, it opens up the blood-brain barrier and allows chemicals that we're already exposed to cross deeper into the brain. There's a study done in 2012 by the senior scientist at MIT, Stephanie Senna, to be exact. And she showed that this chemical is in fact opening up our blood-brain barrier and making people more neurotoxic. We had this conversation. So it's adding to the brain fog. But in her point, it's adding to the dementia, the Alzheimer's, even the diabetes.
And what you're talking about, more commonly known, because I want people to understand this, is you're talking about leaky gut.
Yes.
It has become a huge thing in medicine right now for people to understand that how leaky gut can affect your entire body and how directly, like we were talking about, connected to your brain. And a lot of people that are depressed, it actually starts from the gut, not necessarily the brain.
And not to mention the autoimmune we're seeing, you know, the escalation of autoimmune in people in their 30s and 40s, which we've never seen.
We talked about it. I deal with 5 autoimmune diseases right now that I've been dealing with for the past 15 years.
Thyroid is the canary in the coal mine. It's very sensitive to these toxins that we're discussing, and we can open it up because there's others. But that's why so many young people today have thyroid problems. Even they don't know it. Their hair's thinning, their skin is dry, they have constipation, energy problems, and they can't burn fat like they used to be, okay? Potentially a thyroid. They go to their doctor like I did, because I had all those symptoms actually, and their blood work's normal.
But you know the crazy
thing? Their thyroid's not functioning.
They don't even test, because when I was going through, because I have thyroid disease, they don't even test you for Hashimoto's most of the time.
No.
They very rarely do as an initial test.
You know why they don't? Because the treatment's the same.
Right.
Here's the hormone.
Here's the hormone.
Go home.
Because my T3, T4 are perfectly fine, but I suffer from Hashimoto's, but they would not test for it.
They didn't look at your antibodies.
They did not look at the antibodies.
Because they don't want to test for something they don't do something different for, right? So because they would just hand you the same script for a T4 and say, take this, when even if your blood work was abnormal on your T3 or T4, it might make your blood work look normal again. But the problem with that is, if those hormones don't get in the cell, you don't feel better.
Right.
So you go back to your doctor after taking the medication for 3 months, and he does a re-blood test and says, look how much better you are. And you're like, well, I'm not better. My energy's no better. I'm not sleeping. I still have anxiety. I still have all the symptoms. And maybe you got better for a month, but now I'm not better at all. And you said the same thing happened to you. But the point is it makes your blood better. But if the hormones don't get in the cell, you don't feel better.
Right.
Period.